Hi, everyone, and welcome to episode 75 of the Pet Behaviour Chat. And I'm super honoured to be joined today by two experts in the chronic pain field. So we're joined by Dr. James Hunt and Dr. Katie Smithers. And we're going to chat through a little bit about how chronic pain and behaviour fit together. And then we'll talk a little bit also about the wonderful telehealth and teleguidance service that Canine Arthritis Management, who are based in the UK, they offer. And we'll chat a little bit through how important that can be for our patients. So without further ado, welcome to both of you.
Thank you.
Thank you very much for having us.
And I would love it if you could just introduce yourselves and just let us know how you both kind of came into being in the world of chronic pain and what your sort of special interests are within that area. James, do you want to start?
Oh, yes, thank you very much. Yeah, I guess I was always pretty keen on pain management and things, even from graduating back in '98. That led on then to doing a certificate in anaesthesia. And, I worked then in small animal practice, first opinion practice, but still felt that I wanted to know more. So did some acupuncture training, and then I got a lucky break, actually. I worked with Louisa Slingsby and Joe Morrell at University of Bristol, and had the chance to do a master's and then a PhD there, which kind of started off looking at perioperative pain management, and then we ended up doing some pretty fun, interesting stuff looking at pain mechanisms in osteoarthritis. So that then springboarded my chronic pain knowledge and willingness to do more, really.
Yeah. And where do you work now, James? What's your practice?
So I spend half my time as a clinical anaesthetist in a multidisciplinary referral hospital in Somerset, and I spend the other half of my time doing my own chronic pain cases in a clinic. Wow.
That's amazing. I actually also have a certificate in anaesthesia. I got
that
quite early on in my career, but it's always been a big passion. And I think that's also like anaesthesia and behavior. There's so many similarities and things that happen in the brain, which are very sort of crossed over. So, yeah. And how about you, Katie?
So I'm based in the UK as well, and I run a mobile pain management and rehabilitation clinic, and we travel all across South Wales. Similarly to James, my interest in sort of pain management and anaesthesia started actually before I'd graduated, and led to me doing some additional training and getting my advanced practitioner status in anaesthesia. I'm really interested in sort of multidisciplinary team working and how that can improve our outcomes for our chronic pain patients. We have a very small team at the moment, but we're trying to get sort of all of our disciplines involved as best we can to improve all of these patient outcomes.
Yeah, that's amazing. That's something that Hannah and I chatted about quite a lot. So we recorded an episode. So if anybody's listening and wants to go back to it, episode 71, and we spoke about that interdisciplinary and multi kind of team approach, which I think is equally important in anesthesia and analgesia as it is in behavior medicine as well. So there's quite a lot of synergies there, which is quite nice.
Yeah, definitely.
So one of the things I wanted to ask you both is where we are at the moment in terms of pain recognition, because I think that's one of the things that many struggle with. I think, a lot of times trainers or even, pet guardians just know instinctively that there's something going on. However, when they present that maybe to their GP vet, it's difficult to actually get a diagnosis of pain. So, Katie, what would you say? Like, are there any new and sort of exciting new ways of diagnosing chronic pain, or how would you say that that's working now?
I really wish there was something new and exciting, if I'm honest. I've been doing a little bit of sort of teaching to our local clinics, and we've done some teaching with the chartered physiotherapists as well. And we talk about the biggest problems in pain management. And I really think that identifying that our patient is painful is the biggest problem. We often find that our owners are very in tune, but they're going in to see either their vets or whether they're going to see their physio, and they're getting like either a very sort of short appointment just because that's how everything runs over here. But in that sort of time frame, it can be really hard to pick up the subtleties we might see in these patients, whether that's behavioural changes or whether we're seeing sort of very intermittent clinical signs. We like to talk to all of our vets about pain scoring their patients and asking their owners to fill in questionnaires and then having a look at those. And most of them are quite on board once we talk to them about it, but I don't think it's more exciting, unfortunately.
Yeah, no, I didn't think so. And yeah, you're absolutely right. I think, in terms of pain recognition, behavior changes are oftentimes the first things that pet owners will notice, and that's oftentimes when I'll see them as well. So that is such a big point in of itself. James, how about you? Do you think there's anything, or what would your advice be? What do you think that we could be doing better in terms of recognizing the subtleties of pain?
Yeah, no, I agree with what's been said. Obviously the work from Lincoln University suggests that actually a huge proportion of the behavior referrals that they see have underlying pain conditions. So it's number one, the kind of major indicator that there's something amiss. And as we've said, the difficulty is then trying to quantify that and describe that in a clinic setting, because the animals don't express their normal behaviors. People are pushed for time, and so it can lead to some difficulties in communication, I think, between pet caregivers and the professionals involved, and that's not the great basis for working together in the future.
Yeah, absolutely. And have you found that things like video footage and sort of getting some more data like that has been helpful? James, what would you say? Is that a good way to go if caregivers are suspicious that there's something going on?
Yeah, I think that's really helpful, because actually when you can break it down by video, you can watch the posture of the animal, you can watch the way they're moving, you can watch the way that they respond to different stimuli. And so it gives you a much clearer picture of how they are at home, because you're not going to see that in a clinic setting. So yeah, where I can, always ask owners to collect footage at home. I think it's great, and it actually doesn't take an awful lot of time out of the consultation to just review it.
Yeah, no, I agree. So we've spoken a little bit, Katie, about pain scoring and also obviously the video footage. In terms of pain scoring tools, what are your favorites? What do you like using?
It's a really interesting question. If we were thinking about dogs for a second, the two that I use most commonly are, we see a lot of patients with osteoarthritis, so we use the Liverpool osteoarthritis tool a lot, and we find that our referring vets get on quite well with that as well. So that means that they're happy to then report back to us, we've rechecked this and it's better. And I quite like the Canine Brief Pain Inventory, because it's got like a quality of life aspect at the end as well. So we get a little bit more, I think, of an insight into how that's impacting our owners and how they're seeing what's going on too. And then for our feline patients, I really like client-specific outcome measures. I'm a big nerd about that. I really like that. And obviously it's not validated for use in dogs yet, but I think it can be really helpful for our cats. And a lot of the outcome measures that we're talking to our owners about are behavioural indicators. So a lot of them will say he starts to show this behaviour, and that's our indication that his pain scores increased, rather than some of the more conventional measures in some of the other pain scores.
Yeah. And what would you say are the common feline behaviours that are indicative of pain? What do you see commonly?
It's quite variable, I think, in our cats. We've definitely seen some changes in their activity levels in the house. So one of our feline patients, he starts to vocalise when he becomes more painful, to attract his owner to come to that room and then assist him in whichever activity he was trying to perform. So sometimes it's getting up onto the bed, can be getting down off things as well. And we see some changes in things like their toileting behaviour too, so changes in their willingness to use litter trays if they're inside the house, and then obviously changes in their grooming behaviour as well.
Yeah, No, that's really interesting. There's actually some good work that came out from Dr. Margaret Gruen on, I remember one of the particular behaviors that she spoke about is, so when a cat is trying to get down from something, rather than jumping, they kind of extend their front legs forwards and almost kind of try and climb down something. So that's something that I've looked out for more recently, and I was actually surprised to see how often, I did recognize that. So yeah. James, anything to add to those pain score tools?
No, I think I'm happy with all the sort of validated owner questionnaires that we've got for dogs. Personally, I tend to use the Helsinki Chronic Pain Index for dogs. I will use the feline musculoskeletal pain index as well sometimes. But I often try to send out a quality of life questionnaire as well. So actually addressing lots of different sort of welfare type domains, just to get an overall picture of how they're doing as well.
Yeah, no, I love that. Quality of life is such an important indicator, isn't it? I use that quite a lot in my behavior work as well. And it can sometimes just paint that bigger picture, I think, for clients, to just actually take a step back and not just focus on specific behaviors, whether they're pain behaviors or other behaviors, but actually look at the overall quality of life. So that's actually a great mention there as well. Yeah. So before we move on to talking a little bit about the tele-guidance service, I believe there are a number of sort of different pain measurement tools that are, perhaps more tech-based maybe, or, some of the body weight machinery where you can kind of look at where patients are shifting their body weight. Do you, James, do you use any of those in your clinic? Like, do you use any sort of additional tools, or do you kind of mainly focus on pain scoring and behavior?
Yeah, I'm mainly pain scoring and behavior. So I guess the population I treat are more middle-aged and older. They're not so much the athletes, where I think certainly, where we're looking at musculoskeletal disease and younger and athletic animals, then those can be quite helpful for picking up subtle offloading limbs and things like that. But I suppose most of my population I see when it's starting to affect their day-to-day life. I think the tech stuff is interesting. The thermography, so looking at the different temperatures. There's various sort of skin conductance tools that have been developed. I have seen some work assessing them, and they didn't appear to be overly specific. I think thermography may be helpful in some instances, but it's got more work to be done on it. So no, I've not made the jump yet to using those.
Yeah. How about you, Katie? Have you made the jump yet?
No. So I have worked in clinics previously that have had access to force plate analysis and gait analysis and thermography as well. And similarly, I think that they're come into play a little bit more in maybe our younger athletic patients, where we might be seeing more subtle clinical signs. In addition, at the moment, we're a mobile service, so really hard to travel around with any gait analysis. And most of our patients are coming into us with sort of, as they are a bit older, with sort of significant changes in either their gait or their behaviour. And I think that they probably wouldn't necessarily benefit from that, because we're already picking up on their clinical signs.
Yeah, no, absolutely. So actually, I have one more question before we move over to the teleguidance, and that's surrounding treatment. So James, I believe you're doing some really amazing treatments in terms of sort of specific nerve blocking and that sort of thing. Can you chat us through that a little bit? Because I find that so fascinating. So in terms of treatment modalities, what are the different tools that you have available there?
So we do offer musculoskeletal ultrasound, and then leading on from that, we've got the capacity to do ultrasound guided nerve blocks. Well, I guess not so much blocking the nerves, in a technical sense, as desensitizing. So the standard treatments are sort of a corticosteroid, or potentially we have used things like botulinum toxin as well.
Yep.
There are some, there's some interesting work going on things like capsaicin and resiniferin that might give a much longer lasting, sort of specifically nociceptive blockade, which would be great, but those tools aren't available to us yet. They're not appropriate in every case, but for some we've had some really pleasing results. So I think it's trying to go back to the welfare issue. It's trying to fit everything into a holistic view and what's best for the patient.
Yeah, no, that's amazing. I'm just fascinated by that. When I heard that, Botox was being used for pain management, I was like, wow. Although actually one of my colleagues has Botox specifically for migraine treatment. So yeah, it's definitely, I think, something that's becoming more widely applied, I think, in human medicine and now in veterinary medicine as well, which is really interesting. Yeah. Katie, how about you? What other sort of treatment modalities would you opt for, including, I guess, medications and lifestyle changes and things like that?
Yeah, so we're in a similar situation where we're trying to have like a holistic approach to every patient individually. So gosh, I could go on about it all day, but there's going to be a lot of pharmaceutical options. So we often find our owners are initially that's what they're thinking about when they come to the appointments. But we also do sort of acupuncture, electrotherapy, so laser, pulse mag, we do therapeutic ultrasound, we do a little bit of MSK ultrasound and some local regional analgesia as well. Don't do quite to the same extent as James. And then I work very closely with a chartered physiotherapist, so she does a lot of manual therapies, and we'll go through their lifestyle management quite heavily as well. So I think often we will talk to people about the fact that they could have everything else going absolutely perfectly. So you could have your medication, you could have had your nerve blocks, you can be doing your physio exercises, but if you haven't addressed your lifestyle management, we're still going to have problems. So if we're going to slip every time we come down the stairs, it doesn't really, everything else isn't going to keep us on top of that.
Yeah. So
we go through that quite heavily as well, which, as I say, I think is not necessarily what the first thing our owners are thinking about, but probably the easiest things to do.
Yeah, exactly. I mean, that's so interesting. And you actually took one of the questions I had away there, which was, do you work with physiotherapists? So, obviously you do, which brings us really nicely onto this kind of multi-team approach to both chronic pain patients, but also behavior patients. So, Katie, can you talk a little bit more about your work with the physiotherapists?
Yeah, absolutely. So we have a chartered physiotherapist who comes to every clinic that we travel to do their pain management. Most of the patients we see do end up seeing both of us, even if I see them initially to try and get them a little bit more comfortable so that they can get absolutely everything possible out of their physio. And then to be honest, she sees a lot of patients that are referred in for physio and is like, oh, this patient's very painful. We need to get them in to see Katie as well. So I think that works probably both ways across a lot of the different aspects of our team. So we have a lot of local sort of trainers who will recommend referring into us as well. So they'll see pets for sort of more sort of minor behavioural changes and say, actually, we think this is pain based, let's get you back in to see them. So that works quite well in line with our physio as well.
That's brilliant. I mean, it's so great to start hearing that there is that approach now where, trainers are recognizing the underlying physiology and are actually referring back. And that's something that, maybe 5 years ago wasn't so mainstream, I think.
Absolutely.
Yeah. How about you, James? Do you also have a physiotherapist that you work with?
We don't have one specifically on site, unfortunately, but actually we're quite blessed in that there's a number in the local area. And we've got good work with all of those, but very, very much it's often trainers or physiotherapists who are spotting issues and then referring into vets. Say, please, can we follow this up? I think certainly when I graduated, we looked at lots of things in isolation, organ systems in isolation, and maybe had less appreciation of the impact they had on behaviour, certainly. And behaviour was a bit of a black box when I graduated.
It still is, I think. Yeah, no, that's really interesting. And again, really lovely to hear that there is that sort of multidisciplinary approach now, which is, I think, what we need. So that brings me really nicely onto the teleguidance service that you're part of. So again, I chatted with Hannah and Evie about this in episode 71. And they sort of introduced, I guess, what you guys do there. But I'd love to hear from you both a little bit more about that, how you're involved with it and how that works. So James, do you want to take us away a little bit about that?
Yeah, sure. I mean, it came out of a discussion that we were all having, and I guess certain frustrations that it was difficult for us to be available to the number of people that might, want our help. And I guess as we discovered during COVID, then actually technology now makes remote consulting and remote guidance much more practical, and can actually be a real great adjunct to physical assessments as well. So we're able to review photos and video materials. We're able to review, investigations that have been done with local vets, and also take into account sort of the owner's impression of what's going on, and sort of collate this into a holistic package, I suppose, where we can then make suggestions as to any further investigations that might be worthwhile in the first place, and also any kind of medication tweaks or anything like that. Lifestyle changes, obviously weight and feeding come really high on the list, but also to give the owners the opportunity, I suppose, to feel listened to and have the opportunity to address any worries, concerns, fears that they've got.
Yeah, I think that's such an important piece. And, we spoke about it when I chatted to Hannah and Evie, and it's the same in the behavior world. It's actually that time that we're able to give pet owners that is almost more valuable sometimes, just having somebody to listen to, and then being able to make those recommendations and changes and tweaks, like you say, but building that relationship with the client and actually understanding, what their life looks like because of the concern that they have about their pet, I think is a really, really valuable piece, definitely.
Absolutely.
And so, Katie, do you tend to consult more with the pet owners, or do you do vet to vet consults? How does it work? Who do you serve?
So mostly pet owners, but there is the capability for the service to run with multiple people on the call. So if, for example, you wanted to have our general practice vet, our physio, maybe our behaviourist, there's a lot of options, so we can have everyone there, so everyone is on the same page with regards to that sort of patient's treatment plan, and with the owner's sort of concerns and goals as well, because sometimes obviously if you're seeing multiple different professionals, it's really nice to have an environment where everyone can be there to sort of discuss what's going on and be aware of the sort of plan that everyone's discussed going forward.
Yeah, no, that's so amazing. It's actually funny. So I see a lot of behavior cases where the trainer who maybe has referred to me is also present. So I work with a couple of trainers that are based in the UK, even though I'm over here in the UAE. And when we've seen those cases, the trainers have been there on the call as well. And it's just made it so much more helpful, I think, for the client, but that everyone's on the same page. Everyone knows what's being discussed. We're all on board with everything. And I believe that a lot of trainers don't get that perhaps from other professionals. So I think, again, it's an area that we just need to be opening our doors more and just, having that collaborative approach. So I love that you guys do that you're very willing to bring on board everyone that's involved with that pet's care. So that's great.
Yeah, I think it's super helpful, in terms of follow-up as well, to have feedback from everybody that's involved with that pet as well.
And then, you're all sort of going through the same information with that client. So if there was something subtle or something that they'd overlooked, so it's a lot of information to go through, then maybe the trainer or our physio can say, oh, well, remember we talked about this. It's a little bit just everyone's at least singing from the same hymn sheet.
Yeah, no, absolutely. And there have been occasions where, because of that collaborative approach, we've actually gone, oh, maybe we need to bring in a neurologist or, yet another person to just have an eye, because, we're all seeing something that we need perhaps another specialist to come and look at as well. So I think that's really, really valuable as well.
Yeah, definitely. Because, osteoarthritis is so common, that's almost our sort of default musculoskeletal issue, but undoubtedly there are other conditions as well, neurological and orthopedic, and sometimes it can be really helpful to have a number of people saying, something doesn't feel quite right about this. We need somebody involved. So I'd agree.
Yeah, well, that's amazing. So we are going to post the link to the teleguidance service in the show notes, and we will definitely let everybody know where Cam can be found. Do you guys have any social media platforms or anywhere where people can find you specifically if they want to get in touch? Katie, how about you?
We are on social media. Our clinic's called Faith Referrals, and we're mostly posting adorable photos of dogs. So
I love that. That's great. And so you say you're a mobile pain service that serves, is it the whole of Wales or south of Wales?
South Wales. So we go all the way from sort of Pembrokeshire, which is very, very west, all the way to just before you get to England.
Okay, that sounds good. And James, where can people find you if they'd like to consult with you or get some more information from you?
Yeah, thanks. The clinic is called Pet Pain Relief. We do have a website. I'm not very good at posting on social media, I will sometimes, but again, it's usually pictures of dogs.
Yeah.
And we cover, we're based in Somerset, but we've had people from down in Cornwall up to London as well, so to the south of the UK.
Yeah, fantastic. So we will definitely get all that information up on the show notes. Any final words of advice, James, from you before we sign off?
No, I think just to say thank you very much for helping raise awareness that actually pain is often presenting as a behavioural challenge, and actually that needs to be nearer the top of our list if we are presented with animals who have maybe don't have a behaviour problem in inverted commas, but a behavioural change.
Yeah, no, absolutely. I actually saw a patient just recently who had a sudden change in behavior after being stable for a long time. And, immediately your thoughts go to physical health, and pain is always on the top of the list there. So absolutely, when there's a change in behavior, I think we always need to consider that for sure. Katie, how about you? Any final pieces of advice, words of wisdom?
Well, again, thank you for having us. I think my words of wisdom would be we have to keep advocating for these patients, because I think until, like you say, we're getting more mainstream, but until that happens, we've got to keep trying to raise awareness for how our patients' pain can affect both their behaviour and their owners' lives as well.
Yeah, no, I think it's so important. And I'm so pleased that you guys are offering this wonderful teleguidance service where you can help so many more patients, globally potentially, which is just fantastic. And thank you so much, both of you, for your time. It's been lovely chatting. And thank you very much. And to everybody listening, thank you for tuning in. And I look forward to seeing you all next week for episode 76. Bye for now. Thank you both. Bye.
Thank you.
Thanks.